My name is Dr. Gretta Carroll. I am a board-certified family medicine physician, and I work with SSM Health Medical Group. I see patients from newborn up until the geriatric populations and everything in between that. We focus on overall health, making sure people are treated as a whole, and also like to look at making sure we're taking care of conditions before they get worse or screening for conditions before they even develop, which I find is a real passion for me, is really trying to do preventative medicine. I also like to focus on sports medicine and women's health. Those are two big passions of mine. My style for working with my patients, I think, is very similar to how I deal with most people. I truly do care about them and want to be there for them. I think one of my biggest pushes to go into medicine is knowing I can be that person for somebody. No matter where they're at in life, what they feel about themselves, they can turn to that one person, and knowing that might be me is a huge drive for me. And I think that puts my patients at ease, I hope, because they sense it's genuine and that I really want to be there for them. In essence, we're somewhat of quarterbacks for our patients, especially if there's a lot of specialty care involved. Our specialists are great about looking at the patients as a whole, but they're very focused on one particular aspect. So by coming back to their primary care provider, there's always that center point, making sure things are fitting well together, medications are working well together. And then even though there is specialty care involved, there's still always that center point on preventative medicine, and that will really always bring us back together for that. I've always had a connection with rural medicine. I got to do training with rural family physicians, and it really was something I connected with. I think the type of people you get to meet are always very interesting. Plus, there's a side to where they can't always get all of the specialist care, so therefore you're back into trying to kind of find this new adventure, get creative, and do what you can with them. And there is a sense of community. They care for themselves because they care for their neighbors, and same with our staff. You know, they care about their neighbors and they see them day to day, so it really keeps that passion going.